I came home recently and was told by my daughter that she was starving because all she had for lunch was a cheese sandwich. They ran out of food at lunch, and that is all they had left. And I have to tell you, aside from appalled and frustrated, I was angry. How could the school be so irresponsible? I made multiple phone calls trying to find out who was in charge of this and try to find an explanation as to why this happened. And you know what I found? It happens every day. Children come to school and go home with empty stomachs because of insufficient funds for lunch programs. Not only that, this food that they are served, which we think is supposed to meet nutritional standards, is severely lacking. Because of this, I was recently volunteered to advocate on behalf of parents and kids to implement healthier snacks and more nutritional lunches for the school. It was important that allergy guidelines required by school districts were observed, and obviously watching a very small budget. As a parent, I want to ensure that my child and other children have good, tasteful, nutritious lunches. Overall health of our youth is essential for the growth and flourishment of our communities, and by creating a generation that is health conscious, we will be increasing quality of life while decreasing overall health expenditures of chronic illnesses such as diabetes and obesity. Children spend a large majority of the day at school. Therefore, the impact made by a strong school participation will aid decrease childhood obesity in our country. Story Nanny and Shorts tell us that while the schools alone cannot solve the childhood obesity epidemic, it is also unlikely that childhood obesity rates can be reversed without strong school-based policies and programs to support healthy eating and physical activity. While promoting healthy eating is important, providing healthy choices is even more so. The third school nutritional and dietary assessment studies also confirm that schools' current offerings do not fully support a healthy diet for children and adolescents. Just because something is promoted and advertised as sweet, it does not mean that it's necessarily healthy. Many of the foods provided within the school system are frozen, high in preservatives, not to spoil, and high in unhealthy fats. It is a reality that a much stronger effort is really needed. Studies have shown that obesity and unhealthy eating disproportionately affect low-income and minority children, and almost two-thirds of school lunches served free or at a reduced rate for students from low-income families. Additionally, funding for lunch programs have been essentially cut. Previous successful programs with affluent budgets now try to break even financially. To be able to remain in the black with rising prices, schools have had to take drastic measures and find a balance between cost efficiency and healthy eating. Because of this, many food service directors are compelled to sell popular, lower nutrition foods in the cafeteria, foods that are frequently found in other school venues such as vending machines. The legislation is intended to improve overall health in children within the communities by providing support that is not available at home. Healthy school programs also affect community health by providing an outlet for children, decreasing obesity, diabetes, and other medical costs associated with lifestyle choices. One of the most cited economic impacts of obesity epidemic is the direct impact on medical spending. Obesity is linked with higher risk for several serious health conditions: metabolic syndrome, diabetes, coronary heart disease, stroke, asthma, arthritis. Direct medical spending on diagnosis and treatment of these conditions, therefore, is likely to increase with rising obesity levels. When students do not feel well, they also miss school. This affects learning structures and productivity. Studies consistently find strong correlation between obesity and higher rates of absenteeism. Although large strides have been made, there is room for even more improvement. We can take our surrounding areas and try to take advantage of our local markets. For example, schools near farmlands can create contracts with local growers at discounted rates. If we could integrate local farming with local school districts, it may create a financial incentive for one industry to help another. This will help both schools achieve healthier levels and aid in local economy. Schools in large cities can create similar understandings with local markets. Furthermore, healthy eating and lifestyle changes can make a bigger economic impact in our communities by decreasing recurrent office and emergency room visits due to chronic afflictions. Physicians and hospitals will have more time to attend to patients with more acute problems. And on an outpatient level, this holds true mostly for primary care fields, which is severely impacted due to depleting numbers of general practitioners. In both instances, the decrease in visits will lessen the impact on schedules, allowing physicians to increase quality of care, which is the goal for any practice, whether nonprofit or profit-based.